Okay, so clinical psychology. Today, the topics we'll be covering will be on the honors application process, the different universities and their requirements, giving basic information and background on clinical psychology and information about the field. And then I'll be handing over to our speakers, who are Dr. Martin, Cornelius van Niekerk, and Cayla Bergman. Sorry if I butchered your surname. And then afterwards, we'll have time for a Q&A session. So for the honors application, guys, I'm not going to read through this, but please take note of the different opening and closing dates of the universities and the requirements, and just check what modules will be offered in those years, because each year they usually change what is offered. So please pay careful attention to that, so you make sure you're applying at the right university. University of Pretoria is already open, and I'm not sure when that is closing. You'll just have to check that on the website. University of Witwatersrand is only opening on the 1st of June. Please make sure to pay attention to what their requirements are. Some universities differ, others don't, and the amount of people they accept also changes. So guys, please make sure that your marks are up to standard, and then check the modules that are offered there. University of Johannesburg will be only opening on the 1st of July, and there are their different requirements. University of Cape Town is already open, so if you haven't already applied, go apply. And then these are the different financing options for postgraduate studies, guys. It's difficult to get funding, so please apply in time, check where you can get funding, because this will help you study further if you don't have anyone to pay for you to study. I'll leave this up for a few minutes, well, not a few minutes, a few seconds, so that you can just take a screenshot, take note of that. So please pay attention to this. Next, clinical psychology. Clinical psychology is an integration of science, theory, and clinical knowledge for the purpose of understanding, preventing, and relieving psychological-based distress or dysfunction, and to promote subjective well-being and personal development. Psychologists who provide clinical or counseling services assess and treat mental, emotional, and behavioral disorders. In South Africa, the average salary is about 44,000, but guys, this depends on your experience, where you work, and how long you've been in the field. And then the approximate hours are between 35 to 40 hours, but yet again, this does change, so don't expect to work that much or that little. It changes depending on where you work. And then the different career paths you can take with a clinical psychology degree is a school or career counselor, counseling psychologist, forensic psychologist, marriage and family therapist, substance abuse counselor, and learning disability specialist. There are other fields, so you can also go look into that if there's something else you'd like to do. And then universities that offer this degree are UP, WITS, UCT, UJ, SACAP, UKZN, UNISA, NWU, Rhodes, and Nelson Mandela University. And now we'll be starting with the presentations. Dr. Martin, you can take over.
Thank you, Basetsana. Thank you very much. And thank you very much to you and as well as Psyche for the invitation. Maybe, Basetsana, you can just confirm, can you hear me clearly? Just give me a thumbs up.
Yes,
okay,
I can hear
great. Excellent. Okay. So good evening, everyone, and welcome to the information session that Psyche is hosting. I'm just going to share my screen. Basetsana, I think you've got to stop sharing your screen before I can share my screen. Okay, perfect. All right, thanks.
Is that out of there?
Can I just ask before I proceed if everyone can just make sure their mics are off, otherwise it does create a bit of feedback on my side. So welcome and good evening everyone to the Psyche Society information session on clinical psychology. I'm Dr. Jared Martin. I'm the program manager for clinical psychology at the University of Pretoria. I'm also a lecturer in the department and a registered clinical psychologist and executive member of the Sexuality and Gender Division of the Psychological Society of South Africa. So my contact details are below. The purpose of this presentation is to share with you guys some information, to effectively share as much as I know for those of you who are interested in becoming a clinical psychologist. And what I'm aiming to do is share some information with regard to the general and overarching learning journey that one needs to pursue in order to become a clinical psychologist. I'm going to keep it very brief, so hopefully no more than 20 minutes. There's about 20 slides and I'll average about 1 minute per slide. All the slides are quite dense, and that's because I'm just wanting to share as much information with all of you as possible. So just some information about me to give you some context from the perspective and experience that I'll be talking to. Like I said, I'm the program manager for the clinical psychology degree in the Department of Psychology and the Faculty of Humanities at the University of Pretoria. In addition to that, I'm an academic and researcher. My research principally focuses on critical studies of gender, sex, and sexuality or sexualities. If you are interested in having a look at my research or what I am busy with, you can click on the research profile below, which is my ORCID ID or my research profile ID. In addition to that, I'm a clinical psychologist. I'm registered with the Health Professions Council of South Africa as a clinical psychologist, and I have been registered since 2012. I completed my undergraduate, my honours, and my master's in social science in clinical psychology at UKZN in Durban, my hometown. I completed my master's degree in 2010. And after that, I went on to serve, deploy, and practice as a clinical psychologist in the SANDF. That's the South African National Defence Force. And I was in the SANDF between 2011 and 2019. I exited at the rank of major and thereafter joined the University of Pretoria. Also in 2019, I completed my PhD or doctorate in psychology at the University of Cape Town. And then in 2020, I was appointed as clinical program manager for the clinical psychology degree at the University of Pretoria. And then, as I mentioned, in addition, since 2021, I have been an executive member of the committee, an executive committee member of the Sexuality and Gender Division of the Psychological Society of South Africa. So that's me. Just a disclaimer, my views, experience, and opinions which are expressed here are my own and should not be considered reflective of the University of Pretoria or the Department of Psychology. I'm just going to be sharing with you some information and experience from that perspective. What I'm going to cover is, first of all, what is clinical psychology? What do clinical psychologists do? I want to have a look at what the pros and cons of working as a clinical psychologist are. I will then touch briefly on the academic journey to becoming a clinical psychologist, giving you an overarching picture. I'm going to have a look at what's important to know if you want to become a clinical psychologist, with some useful resources and references as well for your future reference. So, what is clinical psychology? Clinical psychology, as Basetsana has alluded to some extent already, is that it's a specialized discipline of the field of psychology, much like neuropsychology or counseling psychology or research psychology. It is a specialized discipline of psychology.
Dr. Martin?
Yes.
Sorry to interrupt you, but Cornelius, can you please stop sharing your screen because we currently can't see Dr. Martin's presentation.
Sorry about that. Let me just fix that.
No problem. Should I continue?
Yes, please.
Excellent. So, as I was saying, clinical psychology is a specialized subdiscipline of the field of psychology. And what we focus on is the study, the assessment, diagnosis, and treatment of mild and moderate psychological distress through to the most severe and debilitating forms of psychopathology. So when you think about clinical psychology, the thing that probably makes us unique and defines us a little bit separately from the field of counseling psychology is that we specifically are trained to study, assess, diagnose, and treat the most severe and debilitating forms of psychopathology. And these are, of course, the forms of psychological distress or so-called mental illness that prove the most debilitating to people's everyday lives. So the scope of clinical psychology encompasses all ages. So we work with patients from all ages, multiple diversity statuses, as well as in varied systems. So we work with individuals, groups, and families. Clinical psychology is a speciality marked by comprehensiveness and integration of knowledge and skill from a broad array of disciplines within and outside of psychology proper. And what effectively does that mean? It means
Dr.
that we, yes.
Sorry to interrupt you again, but you're going to have to share your screen because we currently can't see it.
I was under the impression I was sharing my screen.
It stopped sharing when Cornelius' screen was shared.
All right, I shall try again.
Sorry for the interruptions.
No. Technology, it happens. Can you just confirm that you are seeing the screen now?
Yes, we are seeing the screen right now.
Okay, perfect. So what do I mean by clinical psychology being a speciality marked by comprehensiveness and integration of knowledge? What I mean is that we draw from fields and subdisciplines within psychology, including counseling psychology, the knowledge of therapeutic techniques and different forms of psychotherapy and counseling. We also draw from neuropsychology for an understanding of the relationship between brain and behavior. We also draw from research psychology because it's our job not just to assess, diagnose, and treat patients, but also we conduct research into different forms of psychological distress and psychopathology. And of course, we draw knowledge and skills from outside of the field of psychology, such as sociology, gender studies, political science, because that's all, we do that in order to better understand the patients that we treat in context, because individuals do not live, they do not develop, they do not exist within a social, political, or economic vacuum. We treat them in context. So we see their health and their mental illness or mental ill health in context. So we draw from a whole range of fields, but still firmly embedded in the subdiscipline of clinical psychology. So what exactly do we do as clinical psychologists? Well, based on our education and training, clinical psychologists work in a variety of settings depending on whether or not they're involved in the research or the practice of clinical psychology. These settings tend to determine the day-to-day nature of the work. And the day-to-day nature of the work is so varied depending on your work environment that I'm not going to go into detail about every kind of work environment you could eventually work in and what your hours of work could be, or even potentially your salary. But broadly speaking, in the research field, you will typically find a clinical psychologist in academia, such as in a university setting, teaching and training. You may find us in experimental laboratories conducting research, experimental research. You might also find us conducting research for the purpose of policy development on public mental health care. In the practice side, you'll find us in private practice, treating patients and clients. You'll find us in mental health care institutions, typically public hospitals and psychiatric institutions. That's typically the classical or traditional home, if you will, of clinical psychologists. But you'll also find us outside of those settings in a variety of public service settings, including correctional services, the police, or the military, which was my background. So in terms of the practice of clinical psychology, because often people are more attracted to the practice of clinical psychology than they are the research aspect of it, clinical psychologists specialize in applying different methods of assessment and evaluation, everything from psychometric tests and batteries of tests and questionnaires and different kinds of behavioral tasks, including projective tests and techniques like your kinetic family drawing test, your draw a person test, as well as the ink blot Rorschach. So we use a variety of different methods of evaluation and assessment, including mental status exams, intake interviews, all defined by a comprehensive clinical intake and history taking. And then we also render different forms of psychotherapy, from psychoanalytical or psychodynamic psychotherapies to cognitive behavioral therapies, systems and family therapies to couples therapies, play therapies for children, defined by different kinds of theoretical schools of thought, all the way from psychoanalytical to cognitive behavioral, person-centered, as well as existential and even post-structural forms of psychotherapy like narrative therapy. Our specialization as clinical psychologists is on rendering high-intensity clinical interventions through the form of psychotherapy. We do not render pharmacotherapy or prescribe pharmacotherapy, in other words, medication. Psychiatrists specialize in the in the prescription of medication and the monitoring evaluation of medication, psychiatric medication, whereas clinical psychologists, we specialize in designing and implementing and assessing clinical psychotherapeutic interventions. So that's often what we conceptualize as the difference between psychiatry and clinical, or psychiatrists and clinical psychologists in broad terms. So what are the pros and cons of working as a clinical psychologist? Well, the pros is that the field of specialization is really, really interesting. Studying the mind and the most severe forms of psychopathology, like severe bipolar disorders or mood disorders, anxiety disorders, as well as psychotic conditions like schizophrenia, which can afflict the mind and debilitate an individual's everyday functioning and mental as well as physical health, is an incredibly fascinating task. And successfully treating patients who were previously severely distressed or debilitating is very personally rewarding. To be able to treat and see patients recover from severe psychological distress is incredibly rewarding. In addition to that, some other pros include the academic journey is exceptionally stimulating. You get exposed to a variety of different knowledges, research, and skills, which is, it's really challenging, both on an intellectual level, but also on a personal and emotional level. So the field of clinical psychology doesn't just require intellectual or academic growth and mastery, but also personal and emotional maturity, growth, and mastery to some extent. And then the remuneration packages, the salary, is pretty good, particularly in the public healthcare system. Clinical psychologists do get paid quite well, comparatively speaking. So in terms of our cons, the field of specialization, while stimulating, is very challenging. So clinical patients are often, although not always, severely debilitated. And I mentioned some of the conditions earlier. And what this means is that progress with these patients, if at all, is really slow. The work is very intensive, and sometimes it leads to emotional burnout and even disenchantment with the process of psychotherapy, because it's so personally and emotionally demanding. The academic journey is exceptionally competitive, and I'll touch on this a little bit later. It's lengthy and requires multiple personal sacrifices along the way, much like any career that requires us to study for a very long period of time. And then, of course, the environments that we work in, namely the public healthcare sector, is often bedeviled by a lack of resources. We are often saddled with high patient numbers, and so that can also lead to burnout, disenchantment. So it's a lot of pressure to work under in the public healthcare system. So in terms of your academic journey to becoming a clinical psychologist, to become a psychologist in South Africa, that is to register and practice as a psychologist, requires a long journey of academic and professional education and training. So currently, psychologists are registered with the Health Professions Council, or HPCSA, in the following categories: clinical, neuropsychology, counseling psychology, educational psychology, industrial organizational psychology, and research psychology. But to practice as a clinical psychologist in South Africa, you must do the following, at least at the moment. You need to successfully complete a master's degree in clinical psychology. This is typically 1 year at a university accredited to offer the degree in clinical psychology. After that year, that academic year, your master's year, you then need to go on to successfully complete an internship in clinical psychology. The internship is 1 year, and it's pretty well paid. So at least during the internship year, not during your year during your master's, you don't get paid. But during your internship in clinical psychology, you do get paid. And at the moment, the salary is very, very good. And that internship happens at a state hospital, which is accredited for an internship in clinical psychology. After that, after your internship, if you successfully complete your internship, you then need to sit and pass the National Board exam in clinical psychology with the Health Professions Council.
Excuse me, Dr. Martin.
Yes.
Sorry to interrupt you for the 100th time today. Are you changing slides? Because your slides are currently not moving.
I I am changing. Does it not? It obviously doesn't reflect on your side.
No, it's not. It's been on slide 6 for a while.
Okay, I'm already on slide 12.
No.
Let me try and, I don't know what the technical issue is. I will try and reload.
Thank you.
Can you see my slide 12 now?
Yes. Can you make it bigger for us?
Yes, I will try and keep it in this view because this view seems to be working at the moment. So after you pass your national board exam in clinical psychology, and that's not just a standard pass of 50%. To my knowledge, at the moment, the pass for that board exam is 70%. So you have to get 70% or more to pass the board exam. Subject to my correction, my understanding is that the pass mark is 70%. So it's quite tough. Many psychologists don't pass it the first time. And then after that, you have to complete a statutory period of community service in clinical psychology. That is 1 year long. That is also paid, much like the internship, and it's paid pretty well. And you do that at a primary healthcare clinic designated by the Department of Health. So the Department of Health then determines where you as a clinical psychologist do your community service, much like medical doctors, dentists, and other healthcare practitioners do their community service. Sorry, let me just yes. So to be accepted into a master's degree in clinical psychology, which is the first step, you're required to have an honors degree in psychology. There are some recommended subjects or modules in clinical psychology at the honors level. So first you have to apply and get accepted to honors. And we tend to recommend the following, and you would have seen from the previous presentation that a lot of the universities offer the similar or same kinds of modules at the honors level. This is by no means prescriptive. This is simply a personal recommendation. So you will likely have to take as a compulsory module your research report and research methodology, because 50% of your master's degree is based on research, 50% is coursework. In addition to that, we always recommend you have psychopathology, because that's the basis of the profession of clinical psychology. In addition to that, we recommend any modules on psychotherapy, modules on psychological assessment, neuropsychology, and health psychology, because a lot of the knowledge and skills you gain from those modules in particular, including the research modules, will be built upon in your master's year. And often in training at the master's level, it is already assumed that you have this knowledge in place at the honors level. So entrance into a master's degree in clinical psychology is selections based. The selection is highly competitive. Most universities that offer the degree in clinical psychology receive hundreds of applications a year. And I do mean hundreds of applications. And most universities, however, from those hundreds of applications, only select about 6 applicants each year. And that's the case for most universities. We'll only select about 6 or 7 students at the most. And that's for the master's degree. So selection is based on university-specific criteria determined by the different universities that run clinical psychology programs. But selection typically involves 2 phases. There's a paper selection where you apply to the university and your application is evaluated, typically by the clinical psychology team, which trains clinical psychologists at that university. And then after that, successful applicants from that phase are invited into a second phase, which is a kind of selections week. And those shortlisted applicants are then invited to participate in a variety of tasks, like a written test, interviews, group activities, and case presentations. That's very much similar to what we currently do at the University of Pretoria. But every university is often quite different. So some general considerations for university selection processes, just things to kind of be aware of. What's often taken into account are the following, but not always, and each university is different. So, for example, the applicant's overall academic performance in their honors year, the applicant's research aptitude as reflected in research-based modules in the honors year, as well as additional research-based postgraduate degrees like other master's degrees or even doctoral degrees, applicants' additional professional and educational qualifications, applicants' career, work, and volunteer experience in the field of counseling and mental health, applicants' ability to communicate in multiple South African languages. That's really important because if clinical psychologists work in the public health care space, you have to think about the patient population, which is principally treated in the public healthcare space. In addition to that, the applicant's personality and interests, the applicant's life experience and diversity that they bring to the training team or the clinical degree, as well as the applicant's performance during the selections week itself is really important. So as I head into the last set of slides, I want to just clear up 3 myths about the university selection processes for clinical psychology. These are 3 myths that I've often been confronted with by students. And so let me try and demystify them or demyth them or myth bust them. The first myth is, if I get the highest marks in honours, I will definitely get into a master's degree. Indeed, academic performance is exceptionally important because the degree is highly competitive. Like I said, we receive hundreds of applications and other universities receive hundreds of applications, and we only select about 6 or 7 students from that. But academic performance is just a factor amongst many others in the holistic evaluation of an applicant. As I just pointed out, there's a whole range of factors which get brought to bear. Myth 2 is that I must demonstrate how much trauma I have experienced in my life when I apply. No, a clinical psychology application should not devolve into an Olympics of trauma. There is a very fine line between personal insight and a simply retelling of life trauma. So what most universities look for is an integrative narrative where you're able to bring to bear your life experience, which may include traumas, life traumas, or even your own personal difficulties with mental health, but to bear in a coherent narrative which paints a clear trajectory, a focused trajectory of your candidacy or aptitude for clinical psychology. And then the last myth that I often come across from students is they say, I want to help people, so I'm natural for clinical psychology. No. Please learn about the profession of clinical psychology and consider your personal suitability and interests. You may actually find that if your life experience, if your personality is more attuned to quote unquote helping people, then you might actually be better suited for counseling psychology than clinical psychology. So I try to just put graphically the academic journey to becoming a clinical psychologist so that you all understand. And I think when representing the academic journey to becoming a clinical psychologist, a pyramid says it all graphically and illustratively because it really is a pyramid. You have your undergraduate degree with a major in psychology, which is typically 3 years or 4 years. From there, you have to get into honors. Honors is, of course, selection-based. That is a year long. Most universities only take a small number of students, much smaller number of students. So at undergrad, you're sitting with thousands of students who take psychology. At honors, you're sitting maybe in a class of 60 to 100 at most that take that get accepted. Then from the honors, you have to apply to get into a master's degree, clinical counseling research. So it's a specialized field of psychology at the master's level. That is, of course, selections-based, as I explained, that's 1 year. For the clinical psychologist, if you successfully pass your master's degree, you go on to do an internship in clinical psychology. After that 1 year internship, you then go on to do the national board exam. Only once you pass that national board exam and register as a psychologist with the Health Professions Council can you finally call yourself a clinical psychologist. But up until that point, you cannot identify or call yourself a psychologist. And then specifically for clinical psychologists, this doesn't apply to counseling psychologists or research psychologists, other forms of psychologists. You then go on to do a year of community service. So in total, it's your 3 years undergrad, 1 year honors, 1 year master, 1 year internship, and then 1 year community service. So you're looking at anything from a 7 to 8 year journey. And that's if you do the journey consecutively. In other words, that you move from your undergrad to your honors to your masters. Most students don't, often because they don't get directly accepted from the undergrad into the honors or from the honors into the masters. So the journeys to psychology are quite diverse and very different. And sometimes that's a good thing because people bring to bear a whole lot of different career experiences, volunteer experience, and life experience to bear on their applications for a master's in clinical psychology. So what's important to know if you want to become a clinical psychologist? And I wish someone had told me this. First, consider your personality and interests. Once you do a bit of research into clinical psychology, specifically in South Africa, think about whether your personality and your interests are aligned to that. Coupled to that, try to find out as much about the field as you can. Try to build your CV, gain some work and life experience. This is especially important if you're not selected for honors. Consider becoming proficient in multiple South African languages. This is really important. If you find yourself only being able to converse, for example, in English or one other specific language, our patient populations are incredibly diverse in South Africa, and often their literacy levels are not as good as we would often expect. And so much of the business of clinical psychology is talking to people, interacting with them, preferably in the language of their choice and in their home language, because that's the way in which they best get to communicate the way in which they feel or the distress that they're experiencing. So try and become proficient in multiple South African languages or demonstrate proficiency. Be prepared to make sacrifices, study hard, and compete academically. You saw that pyramid. You go from thousands at undergrad to 60 at honors to 6 at masters. That pyramid is very, very steep. So you need to be prepared to make the sacrifices to compete with other candidates, not just at the university that you're studying at, but against other institutions as well, or applicants from other institutions. Have a backup plan if things don't work out as planned. So often we think we'll go straight from undergrad to honors to masters and boom, that's it. But in actual fact, because the numbers get so steep from undergrad to honors to masters, you have a greater chance of not, statistically speaking, of not being selected than you have a statistical chance of being selected. So it's really important you have a backup plan for a career or further studying or life and work experience. In preparation for an honors application or a master's application, apply everywhere. Don't just apply to one university. Don't put your eggs all in one basket. Scatter them in multiple baskets. I often advise students to apply at every university that offers an honors degree in psychology and every university that offers a master's degree if you're in honors, because the numbers are just so competitive. And then lastly, understand that there are no guarantees and that there is no perfect formula. And even if you do everything right, sometimes you don't get selected. And that's because it's about a holistic evaluation, not only of the merits of your application to a master's degree in clinical psychology, but it's an evaluation of your application against the merits of other people's applications. And like I said to you, at the master's level in clinical psychology, we sit with hundreds of applications every year, not 10, not 20, hundreds. Lastly, I want to recommend all of you to the following websites. These websites provide some really useful information for students who are interested in clinical psychology or psychology in general. I really want to recommend the Department of Psychology's website at the University of Pretoria. The Psychological Society of South Africa has some fantastic websites and web pages and information for students. There's also a privately run student psychology network called Cognition & Co. I recommend that you take a look at what information they provide, and then also the Health Professions Council of South Africa. Sana, that concludes my talk. I hope it was of value to some extent. I apologize that it went on 5 minutes longer than I think was scheduled, but I really hope that all of you found this information useful. And if you have any questions, please don't hesitate to contact me. My contact details are available here on this last slide. But thanks very much for the invitation, and I hope everyone enjoyed the presentation.
Thank you so much, Dr. Martin. It was very informative, and I really appreciate you taking your time to be here and help us. And it doesn't matter that you went over 5 minutes, it's okay. Cornelius will be handing over to you before we go to the questions.
Hello, can you hear me now?
Yes, I can hear you.
And can you see my screen now?
Yes, I can see your screen.
Cool, okay, so hello everyone. Thanks again also for the invitation. Hi, my name is Cornelius and I am currently part of the honors group studying towards that master's selection that Dr. Jared was mentioning. And I just wanted to go over a few super practical tips that I've been using in the journey thus far, just to give you just a bit of an idea of what's to come should you get into honors. And yeah, so let's get going. It's not very long, so yeah. The first thing I wanted to talk about is that it's so different from undergrad, is that planning at this level is very important. Because you are dealing with not just tests, you are dealing with several research-based assignments. A good idea would be to start reading articles, practicing literally your typing speed, and also becoming more proficient in how you plan your time, because you're not just going to be studying from a textbook. You're going to be doing lots and lots of research and writing and rewriting and rereading. And that obviously, in terms of time management, that is quite different from just studying from a textbook where you just have to keep track of how many pages you've got and you keep going. So that, for me, is obviously the biggest difference from undergrad, where it's much more diverse. And obviously, the assignments are lots of pages and lots of reading and lots of additional reading for class as well. So it's much more diverse in terms of the course structure. Then another thing that I wanted to talk about was obviously just quickly mentioning that because of the high workload and the several different deadlines, we've seen in our group at the moment that a lot of time can be spent stressing and worrying, and you often don't know where to start because it's complex concepts that you have to describe and research. And I found that once you start planning, the best tip or the best idea is to physically just start with whatever you can as soon as you can. So some of the study guides get sent out before class starts. And the best thing that I did was start immediately, because that actually saved me a lot of time, reading time, because you have class, you have group assignments, you have to spend a lot of time, as I've said, doing research. So making it as manageable as possible means starting as early as you can. And then another super practical tip. And people often talk about motivation to start studying every day, or getting up early, or staying up late. And I've found that making something a habit, which you've obviously started doing now in your third year, if you are applying for honours, meaning that you are quite academically proficient, is that you should set up your day and your habits so that motivation is not even a question, because you won't be motivated for a lot of the time that you need to be studying. And if you can figure out what structure in your day works for you in terms of when are you most creative for studying for the test, or when are you better at reading, is that late at night or early in the morning? If you set up those habits early and consistently, that would lead to a very productive year. Another thing that I found is very helpful at the moment is if you, within the class, team up or just buddy up or make a friend in the group itself. And I point out the fact that it should be someone in the class and not just outside of the class, because you're going to be talking to them about psychopathology and research methods and quantitative and qualitative research, and they are not going to want to hear about it as much as you are going to want to talk about it. So that actually helps a lot of us quite a bit, because we get to just talk amongst ourselves, not just clearing up assignments and projects and scope of what to do, but just in general support and friendship. That helps a lot, because the program is very intense and it's quite full, and it keeps going. I mean, you study through holidays and you keep doing research over the weekends. So having someone to talk to that knows what you're going through is extremely helpful. Obviously, another thing would be to look after your health. That is something that is often said, but it's very difficult to do. So again, for me, the best idea, or the idea that worked the best, was to actually schedule it in. So I have a dog that I have to go and walk every day, twice a day. So she keeps me on a schedule, and also as a reminder to just step away for a minute, even if it's a few minutes every day, but you do need to see some sunlight, because it can easily look so overwhelming that you do not spend any time looking after yourself, and then by next year this time, in the month of May, you are so tired that you won't even have the energy to face the exam. So make sure that you do somewhere in the week, just schedule a little bit of time just for yourself, just to ground yourself and take a breath and just take a step back, and then you can carry on. I found that helped me a lot up to now. And then one of the final things I wanted to say was that another exercise that really helped me in the honors, especially during the exam, is to visualize actually what I wanted to achieve. And the best example I can give of that is if you think about when you're going on a holiday, the idea that when do you feel like now I'm on holiday? Is that when you're sitting on the airplane, or when you're putting your toes in the sand, in the beach sand, or when you're driving to the airport? When do you feel like, okay, now I've achieved the goal? And I would advise you to do the same for your goal of getting into honors, whether it's getting the marks for the exam or getting the letter of acceptance. Find out for yourself, what is that goal, and literally put that up on a wall and say, okay, I want to end the year with 87% average, and put that little figure on the wall and look at that every day. It's something silly and sounds stupid, but it just keeps you motivated and going in the right direction. And then lastly, I also wanted to reiterate what Dr. Jared was saying in terms of the importance of having a plan B, because that takes a lot of pressure off of you, especially during the exam. And by plan B, I do mean a fully formed idea of what you're going to do when you don't get in. Not just a fleeting glimpse of, oh, I'll try this or I'll try that. Literally knowing, okay, if I don't get in by this date, then I'm going to move on the next month and either look for a job or start a business or do a course or do something specific. So the plan B has to be very specific, because that also helps to keep the stress levels very low during the exam, because you will, when you start freaking out about the workload, or you feel tired and you think, oh, I'm not going to make it. If you have in the back of your mind a fully formed plan B, that really does help a lot with the idea that you really need this degree, or you need this acceptance into honors to survive, or you really want this. And that for me was also a big difference, because if you need it because you have no other option, then it's going to be a stressful time. But if you really want it as something that you want for your life and your personal development, that completely changes the picture of how you approach the exam, how you approach every day that you have to get up again and study or do research. So I would advise you to make sure that that plan is in place. And I mean, even if it doesn't happen, even if you do get into honors, it's always good to have a second option, both in interests and in life. And it really helps to keep you on an even keel as you navigate the stormy seas of getting into honors. Yeah, no, and the mindset has to be, for me, one of the most important things. And it does help if you can manage the stress and the way that you think about yourself going forward. I mean, if you constantly doubting whether you're going to make it or achieve the goal that you want, then it's going to be really tough for you to carry on and keep going. But if you can visualize yourself in terms of your life, not just in terms of a degree, in terms of in a more positive picture, that already gives you a more positive outlook just on every day, every Monday, as opposed to stressing all the time and wondering where you're going and what you're going to do and how you're going to do it. And I've found that as well to be very helpful. Yeah, I think that's about it. You're welcome to send me any questions you have. This is my email address. And any questions you have, advice or tips, I'll be welcome to ask and I'll answer it for you. And yeah, good luck. And thanks again.
Thank you so much, Cornelius. It was very informative. Cayla, I'm not sure if you are ready to present now.
Hello, I am. Unfortunately, I don't have a presentation because of load shedding and stuff like that, but I will talk through. So I just wanted to start off by saying, hi, I'm Cayla Bergman. I'm in honors with Cornelius, actually. He's my buddy. He says, you have to make friends. Well, he's one of my buddies that I message all the time. And I'm like, I don't understand what to do. Please help me. So he's that person for me. And yeah, the point that he made about having a buddy and having a partner to just talk about things and talk about the course and de-stress yourself with, I think that was extremely important. I think it's very, very necessary. So the position that you guys are in now and you're stressing for honors and you're like, oh my gosh, what am I going to do? We were all there. We were both there, and it is stressful, but I need to give you guys congratulations and motivate you guys because you guys can do it, whether it's through TUX or another university like Wits, UCT, or Stellenbosch. You guys can do it. If it's not this year, it's the next year. If you really want to do it and it's something that you see yourself and visualize yourself, as Cornelius said, doing, then you can do it. And it's very important to continue motivating yourself and believing that you guys can do it. So I'm just going to, I don't know, I wasn't here in the beginning of the meeting because I was on a different link that had no one. So I was very confused. But I don't know if Dr. Jared mentioned it. But a question that was asked in the counseling session of this Microsoft Teams was what topics or subjects or electives are important in taking in honors? Because obviously you're like, okay, so what should I take as a clinical, if I want to go into clinical psychology? So you have 3 core modules, which is your research methodologies, your research proposal, and your theories and paradigms. Those are extremely important that you do well in and that you understand them because they make up the basis of what you're going to do as you further on your studies, as well as it makes up the basis for all your other electives. So then you can choose 4 electives. And basically what we learned while we were choosing our electives is that all the electives that TUX offers you will give you the overview of what to expect for masters. So there's no particular subject, for instance, like psychopathology, or even if you were to take therapeutic psychology, not one of them is going to disqualify you from getting into masters if you were to choose a different elective. TUX structures their honors program quite holistically so that all the electives that you have will make up for what they're looking for in masters and what a well-rounded holistic student they're looking for. The subjects that I take or my electives is psychopathology, neuropsychology, health psychology, and what else do I take? Can't remember the last one. Psychological assessment, which is in 2nd semester. So your first semester seems extremely stressful. And just to reiterate what Cornelius said is you have to plan. So what I found works is if you have multiple calendars, diaries, sticky notes. Sticky notes are amazing because you're able to visualize quite colorfully as well as simply what needs to be done in the day. So I have a diary, I've got my phone, my laptop, and then my sticky notes. And being able to plan the dates and what's happening on one day and what's happening to the next day is extremely important because it can all feel so overwhelming. And even for your 3rd year, I think it's very important with the assignments and the tests that are coming up. You need to start being able to visualize what you want your week to become and what you want to achieve in that week. So by the end of this week, I want to finish all my psychology notes or all my research 320 notes. All of those things, you need to be able to say, I'm going to get it done. Because if you keep on pushing it back and you're like, okay, I've still got a week to do it, it's not going to get done. And something that was discussed the other day in the group is we have all this time, but because we're so busy, the due dates are what we look forward to, is to get these assignments done. So yes, you have time to do these assignments. Everything else starts filling in your week. So as soon as you get it, read your study guide, read what's expected of you, and then start planning, start getting your ideas out onto paper or onto your notepads. Because once you do that and you get all this energy out and all these thoughts out of your head and onto paper or onto something concrete, it's way easier to start an assignment or start studying for something when you have visualized it. And then the last thing that I wanted to speak about is working during honors. So if you were in the counseling psychology Microsoft Teams, you would have heard me speak about it, but I am working during honors. It is not advised. And please don't take that lightly. It is very difficult to maintain a job as well as honors and still want to do well. It is very difficult, and time management is honestly going to become your best friend, as well as just knowing what you want at the end. So I know for some of you, working is something that you have to do or something that you would like to start doing. It also gives you life experience, which is what they do look for in masters. So for instance, I am an au pair. I also tutor, and I also do some admin very informally for the SAB. And basically how I manage my time is with tutoring. I make sure that my weekends, I don't take on too many students. I enjoy teaching, so that's why I tutor. And tutoring is an easy way to make a couple of $100 every weekend. Say, for instance, if you have 3 students and you're really good at tutoring English, it's really easy. It's an hour per student, and it's money coming in. Au pairing is a little bit more difficult because you need the hours and you need to, be with the kids quite a lot, but it is manageable, especially with this year. Our lectures are in the morning. So we are able to get our lectures out in the morning, and you start quite early, and then you go to work for I work for 3 hours a day, and then I come home, and then, you can sit and you can do your work afterwards. So I definitely think that it is very difficult to work during honors. It's not something that is easy or even recommended by lecturers or professors, but it is manageable if you do know how to time manage, and if it is something that is necessary for you to do. Obviously, if it's not necessary, then don't put yourself under that extra pressure to try and work and manage honors at the same time. So yeah, and then the last thing is you guys have to congratulate yourselves at every small achievement you guys have. If you guys go up by 3% or even 5% for something, if you really feel like you've written a really good essay, congratulate yourselves on those little achievements, because that's what's going to push you into wanting to do honors and wanting to do third year properly or second year properly. Is by motivating yourself. Because if you don't believe in yourself, and I know how cliche that sounds, but if you don't believe in yourself and you don't believe in the work that you're putting out or the effort that you're putting into the work, you're not going to get the results back. So just like Cornelius says, you've got to visualize, you have to create these habits, these positive habits. You also have to congratulate yourselves and be proud of yourself, because if you aren't, you're never going to feel like you're enough. And you're never going to feel like what you're doing is enough. And you're going to constantly be disappointed. And that's not what you want, especially in honors where everything's difficult and it's not the same as undergrad. The small achievements that you make, like, oh my gosh, I got this much, or I did really well in that group presentation, is really important. So pat yourself on the back, say well done in the mirror, say I can do this. because those positive motivating words and affirmations that you use for yourself is extremely important. So please take that. If anything that you've heard from me today is congratulate yourself and be proud of yourself for how far you guys have come and how far you guys will get to, because you guys are all amazing and you guys will do what is set out for you guys and what you guys can do. So yeah, that's me. I hope you understood what I was saying. And yeah, I wish you guys all the best and thank you.
Thank you so much, Cayla. That was like very inspirational. So guys, now we'll be going to the Q&A session. If you have a question, please raise your hand, or you can type your question in the chat box, and you can either say if your questions directed at Dr. Martin or Cayla or Cornelius. Dr. Martin, I think this question in the chat box is directed at you, and it says, how many times a year does the national board exam happen? Could you be able to do your master's, say, in 2014 and write at the end of 2014, then start your internship in 2015 if you passed, or does it only happen once a year?
Yeah, that's a really good question. And I think the planning out the timeline is just as important. Thinking about how long it's going to take the degree to reach completion or for you to sit your board exam. So just to reiterate, the way it works is you do your academic your master's year. After that, if you pass that year, because that year is in and of itself very academically and emotionally and personally demanding, it is the most demanding year of any psychologist's professional, personal, or academic journey. And even when we select a small group, not all students successfully complete the year for a variety of reasons. So let me just state that. Once you successfully complete that year, you then go on to do the internship. And if you complete that year, you then sit the board exam. The board exam is written at the moment about 2 or 3 times a year. There have been some delays due to COVID. So that's sat about 2 to 3 times a year. Yeah, so you have a couple of chances to pass it, but it is very tough to pass the first time around. Very few psychologists pass it the first time around because not only is the pass rate so high, or the pass mark, but obviously it's the national board exam in clinical psychology. It's a nationally set standard. It's incredibly demanding and tough. Yeah. Did I answer the question, Basetswana?
I think so.
Excellent. Sorry. Long answer to a short question. Apologies.
And then another one is, when do you have to specify if you want to do counseling or clinical psychology?
Is that for me?
I think so.
Okay, yes. Well, you would be applying to specific master's degrees. The clinical profession and the counseling profession, or the clinical psychology profession and counseling psychology profession as disciplines, but more than just disciplines, as identities, as professional identities, are very different. Often people think that they are the same thing, but they are in fact very different. Hence, one of the things we always encourage applicants is to go and find out what is counseling psychology and what is clinical psychology. I mean, every year we get hundreds of applications from applicants who you can see they think clinical psychology is counseling psychology, maybe because of what they've seen on the television or seen in a movie or something to that effect. They think clinical is counseling, but it's not. And likewise, counseling get a lot of applicants who they can see are ideal for clinical, but have applied for counseling. So first of all, research about both professions, and you'll have to make that decision when you apply at the master's level. Honours is a generic degree in psychology, but if you apply for master's, it's either a master's in clinical or a master's in counseling. And yes.
And then, can you do your community service year while you try and redo these exams, or do you have to wait?
No, you have to pass the board exam first before you're allowed to progress to community service.
And then, Dr. Martin, what possible plan Bs would you suggest for someone who has already completed an honours degree?
That is an excellent question. And in some ways, I hate being prescriptive about it because everybody's life journey, personality, interests, and, you know, what they envision for themselves is very different. And so you have to make not only personal decisions about what most interests you, but sometimes we also have to make very practical decisions. In other words, kind of what options are available to us. And then third, we also sometimes have to incorporate a very strategic decision. So if I have an honors degree and I want to get into a clinical degree, and maybe the first year that I applied at all the universities, I didn't get accepted. So now I now have to sit with, okay, how do I build my CV, my profile, which demonstrates a better or more appropriate candidacy? And that can be through so many different forms of work experience, volunteer experience, life experience, different professional qualifications like psychometry or registered counseling, and those are just to name a few, not necessarily to endorse them. But we have people who apply to our clinical program who come from such different academic and career journeys. Given how competitive the program is now, we now see people with PhDs, doctoral degrees who apply, master's degrees, lawyers apply, medical doctors apply. And that also gives you an indication of how highly competitive it is. Yeah.
Guys, if you have any questions and it's too long to like type in the chat box, you're more than welcome to switch on your mics and ask a question. Oh, thank you, Dr. Martin.
Thank you.
Currently don't have any other questions. So does nobody want to ask a question? Don't be shy. Oh, I got a question, Dr. Martin.
Please.
What happens if someone's marks aren't high enough to get into honors, but they still want to continue with psychology? What would you recommend they do to try and get themselves in the honors program?
Oh, into the honors program, yeah. I mean, much like competition for the different master's degrees, competition for the honors placements are equally as competitive, with most universities not receiving hundreds of applications, but thousands of applications just for, you know, a limited number of spaces, which shift each year depending on resources at every department and at every university. So most universities require that you have a minimum academic kind of aggregate, although each university is very different, and I would advise you to look at each university's specific requirements. But the minimum typically is around 70%. I know that is the case, for example, at Tux or the University of Pretoria. With that said, that is just the minimum. And one should not necessarily aim for the minimum, but aim for a significant percentage above the minimum. Because achieving the minimum on a mathematical level, given the number of applications received by each university, probably doesn't even put you in the top 900 of the applications. So that's just on a very basic practical level. But you would then need to decide what, for example, you're interested in, how best to build your CV, because that's really often what it's about. You know, one of my favorite reality television shows, and I live vicariously through it, is Survivor. And often in Survivor, they talk about building your CV for the jury because you want to pitch your win ultimately at the final tribal council or whatever it's called. And so in many ways, your journey in psychology, because it is so competitive, is about building your CV from day one, first year undergraduate studies. It's about building that CV, not waking up in third year or in honors and saying, oh, let me now study an African language so that I can demonstrate proficiency in communicating with multiple cultural or ethno-racial groups or language groups in South Africa. It is really about building that CV from day one. Yes, I hope I answered the question.
Yes, you did. Thank you. This one is similar to the one I just asked. It says if you happen not to make it after your master's, maybe you don't pass well. Does that mean it's the end of trying to get into being a psychologist?
I mean, that's a really good question because it does happen, unfortunately. and for a variety of reasons, because a master's degree in clinical psychology, I can't speak to the other kinds of psychology. They don't only require that you master the academic or intellectual content, the subject matter, but also that there's an incredible amount of personal and emotional growth that has to happen in that 1 year that we have you, because of how deeply intense the work of clinical psychology is when you go on to sit with patients and treat patients and work with patients who, because of often their level of psychopathology or the degree of psychopathology they sit with, they are incredibly vulnerable. So there is a lot required from you in that clinical year, in that academic master's year. But the clinical team who selects you also supports you through that. We don't just expect you to master things. For example, once every week, every student attends supervision with a member of a clinical training team in the department. And we sit with you, we help you work through your cases, diagnose patients, develop treatment plans and assessment plans from your patients, because you start seeing patients in your master's year. In the second month of the degree, you start seeing patients. So we supervise and we assist and we support you as best as we can throughout that year.
Thank you. And then Jordan, you have your hand up.
Yes, hello. Can you hear me?
Yes.
Okay, I just wanted to ask, since it's so difficult, like in South Africa, to apply for masters and all that, what does it look like? You know, is it worth trying in like overseas to apply? And like, what does that look like?
Well, what I can't speak for institutions are, overseas, they have very specific sets of criteria to apply, much like we do. But that is something that one, I think, needs to research depending on what area or region or country you would be interested in. Then within different countries, there are obviously different universities which have different requirements. So I think that would, I always say apply as widely as possible. And I guess that moral of the story would also apply to international universities. But much like overseas, the numbers they select into their degree programs are very small. The competition for them is incredibly high, and it's really tough, but yes.
Cornelius, you have your hand up.
Yes, I just wanted to add on that point. I did actually do some research when applying for honours on overseas degrees, and there are quite a few options on online universities in the UK that you can actually apply to from South Africa, which I actually did. It's just the main factor is obviously the cost, because foreigners are normally the ones who pay more for the degree, because in those countries much of tertiary education is often subsidized or even free. So it's definitely an option. The only thing is that many of the overseas countries also require that you have to, let's say, in a PhD before you can actually start practicing. So there is a different pathway in different countries. But I would definitely say it's an option, especially for honours, to look at online universities.
Okay, thank you so much.
Do we have any more questions? It doesn't look like we have any more questions, so I guess we'll be ending now. Dr. Martin, Cornelius, Cayla, I'd just like to say thank you so much for taking time out of your day to come and speak tonight. We really appreciate it. It was like very informative and helpful, and thank you so much.
Thank you. Thank you, everyone.
Good night, everyone. Hope you have a good night and good luck with your studies.
Thanks again.
Pleasure.
Bye,
See you next
guys.
time. Good luck.
Thank you. Gonna need it.
You'll be all right.